Come in.
I'm Margaret, your student nurse for today. Can I get you to give me your name and birthday, please?
Tyson Davis, 32681.
Okay, we're going to do a head-to-toe assessment today. And the nurse tech has already been in to take your vitals. I'm going to check for any lesions, abnormalities, or depressions. Okay, now we're going to palpate your sinuses. Just tell me if you feel any pain.
No.
Okay, and we're going to check your eyes. If I can get you to look up. Your conjunctiva is pink and moist, and have you look down. And your sclera is white. And we've already checked your cranial nerve number 2, the optic nerve on the Snellen chart. And your nose is symmetrical with your face. And we'll just have you flare your nostrils, please. Okay, we'll check your patency. Have you sniff and sniff. Okay. And we're going to check your eyes. Okay, and the pupils are round and even, and they react to light. And just have you look at the pen, and look at the wall, and look at the pen, and they accommodate. Okay, I'm going to look at your nose. And mucous membranes are pink and moist, and there's no deviated septums. And we're going to check your mouth, and the lips are moist. I have you open. Mucous membranes is pink and moist, and your teeth are white and straight. I'll just have you stick your tongue out side to side. Okay, that's your hypoglossal cranial nerve number 12. Okay, I'll have you close your eyes and tell me if you can feel this. This is your cranial nerve number 5, the trigeminal.
Yes.
Okay, have you open. We're going to check your cranial nerve number 7, the facial. Just have you puff out your cheeks, smile real big. And now we're going to check your ears and tell me if you have any pain.
No.
Okay, we're going to check your cranial nerve number 8, the acoustic. Just have you cover one ear and repeat after me.
1, 2, 3.
Have you do the other side.
5, 6, 7.
Okay. And now have you look up. And your trachea is midline with your body, and there's no edema or urethra around the thyroid. And we're going to check your cranial nerve number 11. Let's have you push up. Okay, have you push against mine. And it's a spinal accessory. Okay, we're going to see if, check for any temperature and any excessive moisture, and there's none. I'm going to oscillate the lung fields. Just breathe normally. Okay, and that's 5. And now we're going to check. Your heart is located in between the 2nd and 5th intercostal space. And on the right, 2nd intercostal space is your apical. The 2nd intercostal space on the left is the pulmonic. And the 3rd intercostal space is your Erb's point. The 4th intercostal space is the tricuspid. The 5th intercostal space is your mitral, and your apical pulse is in the 5th intercostal space, mid-clavicular. And I'm going to listen to your breath sounds in the back in all 9 quadrants. And there is no respiratory. There's respiratory excursion. Now I'm going to check your carotid pulse on both sides, but not at the same time. And now we're going to oscillate the carotid pulse. And we're listening for breweries. If there's any breweries, there'll be a whooshing sound, and that would mean a stenosis or a blocked artery. I'm going to check your range of motion. If you'll just do what I do. Extension, flexion, abduction, adduction. Okay, and we're going to check your pulses, your bilaterally. This is your brachial, your radialis, and they're even. We're going to check for any temp or excessive moisture, and there's none. Check the turgor, and there's no tinning. There is no clubbing, and your capillary refill is within 3 seconds. Okay, now we're going to check your neurological sensation. Okay, this is sharp and this is dull. Just tell me what you feel.
Sharp. Dull.
Okay, we'll do that on both sides. Okay, now we're going to check your deep tendon reflexes. This is your bicep, your tricep, your brachioradialis. Okay, do you do a monthly breast exam?
No.
Okay, even though it is mainly women that people know about, men do get breast cancer. If you'll pick a date, anytime during the month, you can do it in the shower or laying down. If you'll just, I'll show you how to do it. Put your arm up, start at the talus spence, and work yourself down and around all through the breast, and squeeze the nipple. And if you have any kind of discharge, then you need to see your physician. Okay, if I can get you to lay back. Okay, we're going to oscillate your abdominal sounds, and they are hyperactive, hypoactive, audible, or absent, and you have to listen for a full 5 minutes to declare them absent. This is your right upper, left lower, right lower, and now we're going to palpate in the same quadrants. Okay, we're going to check your pulse. There is your femoral pulse, popliteal, dorsalis pedis, and the posterior tibial. And we're going to check your range of motion. And we've got extension, flexation, abduction, adduction. And we're going to check your neurological sensation. This is sharp, this is dull. Just tell me what you feel.
Sharp. Dull.
Okay, and you do that on both sides. And we'll check the capillary refill. It blanches in 3 seconds. There's no clubbing. We'll check your plantar and your clonus. I'll have you sit up, please. We'll check your deep tendon reflexes. This is your patellar, and this is your Achilles. Okay.
Done.
Done.